Hey everyone, it's Mikael here with a quick video on how we perform manual white blood cell and platelet counts using the BMP Leukocheck system. So we can see the necessary supplies in front of us here. So we've got the Leukocheck reservoir with the solution that's going to lyse our red blood cells. And we also have the capillary tube. This is going to allow us to get the whole blood sample into that reservoir. And then we also have our blood sample supplied, our whole blood sample, in a microcentrifuge tube. So you'll want to make sure that is well mixed before we add it to our reservoir. We also have the hemocytometer contained inside of this case. So you can see the hemocytometer along with the cover glass that's going to sit on top of our counting grid, and we will show you how to prepare and set that up in a few moments. We also have a couple of other supplies. We have a petri dish here, we have a wooden applicator stick, as well as some distilled water. So the first thing I'm going to do here is just label that reservoir with some type of patient or sample ID. Always good practice to label up your reservoir to keep things organized, to make sure there's no mix-up of specimens. So I just wrote the sample ID on the reservoir itself. And the next step is to actually puncture the top of the reservoir using that plastic shield that's sitting over the pipette. So what you're going to do is grab hold of the reservoir firmly on your bench, and then grab hold of that capillary tube and push straight down using the plastic tip to puncture right through the top. And you can see that there's now an opening inside of the cap of the reservoir that will allow us to get our sample through. So next we're going to grab hold of that pipette and remove the plastic shield. We can do this by twisting and pulling the two pieces apart. And you'll see that that exposes the capillary tube that was housed inside of that protective shield. Now what we want to do is fill this capillary tube up with our whole blood sample right to the tip or the base of that pipette, right where I'm pointing here, and this will actually fill automatically and stop on its own once it's had enough blood. So I'm just going to mix that microcentrifuge tube a couple times, and I'm using the orange absorbent paper here to open up that tube to prevent any splashes or aerosols from being generated. And holding the blood sample almost completely horizontal, I'm going to insert that capillary tube into the microcentrifuge container, and what you can see is through capillary action that blood is slowly starting to make its way into that capillary tube. Sometimes this takes a little bit of patience. You can also rock that tube back and forth to sort of encourage the blood sample to make its way all the way up into the capillary tube. So that's what I'm doing here. I'm just sort of helping or pushing that blood inside the tube just to get it a little bit higher so that it is completely filled. So now that it's full, we're going to remove the capillary tube, placing the lid back on to the microcentrifuge tube. And we're going to carefully wipe the outside of that capillary tube, making sure not to touch the bottom so as to draw blood out of the capillary tube, just to get any excess off. Now we're going to gently squeeze that reservoir to create some pressure. You can see how I'm squeezing the sides here. And then with my index finger, I'm going to cover that opening on top of the capillary tube, stick it in through the opening all the way down, and then gently let go of the reservoir. That essentially creates a vacuum that's going to suck the blood out of that capillary tube. What I'm doing here is I'm gently squeezing the sides of the reservoir to move fluid up and down that capillary tube to get all of the blood out of that capillary tube that was stuck inside. And then you can also cover the opening at the top with your index finger and invert the reservoir a few times to make sure that blood is adequately mixed, to make sure all of our red blood cells are mixing with that ammonium oxalate solution to lyse them. And once that is mixed, we're going to let that sit for 10 minutes to allow all of those red blood cells to completely hemolyze. So at this point, you would set your timer for 10 minutes. While your timer is going, you can proceed to prepare your hemocytometer for counting. The first thing we're going to do is create what's called a wet chamber or a humidity chamber. So grabbing our petri dish, we're going to break that applicator stick in half and just place them at the bottom of that petri dish. Then I'm also going to grab a Kim wipe and just tear off a little corner of that Kim wipe. And I'm just going to moisten the Kim wipe with some of that water. You don't need a lot of water here. You don't want it to be dripping. Just dampening the Kim wipe and then placing it off to the side inside of that petri dish. The next thing we're going to do is just cover that, and that's basically our wet chamber or our humidity chamber where our hemocytometer is going to sit once it's ready. So we're going to open up the case to that hemocytometer and grab hold. I'm just placing it onto an orange absorbent pad here so you can see it a little better on camera. But we have our hemocytometer, and you can see that the center, there are two grids that is going to show up under the microscope that'll allow us to count these white cells and these platelets. We also want to make sure we're cleaning the hemocytometer really well. Any little bits of lint or dust that remain on the cover glass or on the grid itself is really going to make it difficult to count things, especially our platelets that'll look exactly like little pieces of dust. So I'm just using an alcohol wipe to clean the grid on the hemocytometer as well as the cover glass. And then I'm also going to use some lens paper. Really important that we use lens paper here, not the Kim wipe. This is sort of a very delicate precision microscopic glass instrument, so we want to make sure we're not introducing any scratches. So I'm just going to wipe off the excess alcohol here with the lens paper, doing the same thing on the cover glass very carefully, to make sure all that dust and lint and oil is completely removed before counting. So the next thing I'm going to do here is grab a Kim wipe again with a little bit of water. Now what we're going to do is moisten the sides of the hemocytometer where the cover glass sits, just along the edges, making sure not to get any water on the grids themselves. You can also sometimes use your fingertip with a little bit of water just to slightly moisten those ridges where the cover glass sits. Then we're going to place our cover glass on top of the hemocytometer grid, and that water is going to sort of act like a little bit of glue to prevent the cover glass from moving around too much when we're charging or loading our sample. So with the hemocytometer ready to receive the sample, the next thing we're going to do is prepare our pipette and our reservoir from the Leukocheck system. So you're going to grab hold of the capillary tube from the top, pull it out, and then invert it so the bottom sticks right into the hole of the reservoir, right in the opening. So you want to push down firmly here. And now we have a little mini pipette that will allow us to load our sample. So I've zoomed in here so you can get a really good look at this process. And what I'm actually doing off camera here is dispensing 2 or 3 drops from that pipette to get rid of any excess solution or red cells that might have been hanging out inside of the capillary tube itself. So I'm just dispensing 2 or 3 drops onto an absorbent pad. And now with our pipette ready to go, we're going to hold the capillary tube right against the notch in the hemocytometer, right where it makes contact with the cover slip, pushing gently in the reservoir, and you can see that the grid is now flooded. It doesn't take a lot, maybe about 1 drop, and you can see how quickly the fluid moves over top of the counting grid. Now with our hemocytometer charged or loaded with the sample, we're going to place it inside of our wet chamber, put the lid back into place, and let those cells settle for 10 minutes before we put it onto our microscope and begin counting.